The AMFTRB National Examination represents the final step toward achieving your LMFT licensure in Minnesota. It is designed not just to test what you know, but how you apply that knowledge in real-world settings. This computer-based exam contains 180 questions. Crucially, it prioritizes your ability to use clinical judgment, moving well beyond simple memorization to ensure you are prepared for practice. The AMFTRB exam is a rigorous test of your clinical judgment. You are allotted 4 hours to complete 180 multiple-choice questions. Unlike standard knowledge-based tests, the format focuses heavily on clinical vignettes. These scenarios require you to synthesize information and make real-time decisions in complex therapeutic environments. Understanding these logistical constraints is the first step in building your testing strategy. Domain, one of the AMFTRB exam, focuses on the practice of systemic therapy. To excel here, you must demonstrate the ability to view clients through a systemic lens, rather than focusing solely on individual symptoms. You will be tested on case conceptualization. You must identify interactional patterns, family roles, hierarchies, and multi-generational influences. The exam expects you to assess circular causality within the family system. Finally, your treatment planning must address relational goals. Effective interventions on this exam are those that target the entire system, rather than just the identified patient. The second domain of the AMFTRB exam focuses on assessing and diagnosing clients. This section evaluates your clinical proficiency in applying the DSM-5-TR, conducting risk assessments, and performing differential diagnoses. You must demonstrate a mastery of the DSM-5-TR. It is not just about memorizing codes, but understanding the specific symptom profiles, duration requirements, and functional impairments necessary for accurate clinical labeling. Differential diagnosis is a crucial skill. You will be tested on your ability to distinguish between disorders that share similar symptoms by systematically ruling out alternative explanations, including medical issues and substance use. Finally, risk assessment is non-negotiable. You must be prepared to identify lethality, evaluate the intent behind suicidal or homicidal ideation, and determine when a clinical situation triggers a legal mandate for reporting. Domain 3 focuses on the strategic design of treatment. This is where clinical assessments are translated into evidence-based interventions tailored to the specific needs of individuals, couples, and families. You must demonstrate competence in selecting interventions that are developmentally appropriate for diverse populations, ranging from individual therapy to complex family system dynamics. A critical component of this domain is crisis management. It tests your judgment in identifying when acute safety needs must take precedence over systemic growth interventions. Mastery of this domain ensures that you can design treatment plans that are not only theoretically sound, but also practically effective in real-world clinical settings. The fourth domain of the AMFTRB exam centers on evaluating clinical outcomes. You must demonstrate the ability to monitor client progress effectively and adjust your treatment plans based on real-world data. Therapy is a continuous cycle. After selecting an intervention, you must gather feedback. If outcomes don't align with clinical goals, this domain requires you to rethink your approach and revise the treatment plan. Key competencies tested include your ability to monitor both objective and subjective progress markers. You will be evaluated on whether you can accurately recognize when a treatment strategy has stopped working and how you shift systemic interventions to regain momentum. In summary, evaluating outcomes is about maintaining clinical responsiveness. Stay aligned with your systemic goals and always be prepared to pivot when change stalls. Welcome to the fifth domain of the AMFTRB exam, ethics and legal standards. This section is vital for your licensure, as it defines the boundaries of professional practice. This domain covers 4 core pillars: maintaining confidentiality, executing clear informed consent, managing professional boundaries, and navigating the nuances between legal requirements and ethical responsibilities. A critical aspect of this domain is learning to navigate legal boundaries while maintaining cultural competence. You are expected to uphold the law while respecting the unique cultural context of every client system. Mastering these standards is essential for passing the exam and becoming a safe, ethical, and effective systemic therapist. The AMFTRB exam is unique because it moves beyond rote memorization of definitions. Questions are framed as detailed clinical stories. Instead of asking for a definition, the exam tests your ability to determine the best first intervention tailored to a specific family dynamic. Success depends on analyzing the system, identifying the presenting problem, and choosing the intervention that is both ethically and clinically sound. Success on the AMFTRB exam requires moving past static textbook definitions. You must shift from simple memorization to active clinical application. Instead of recalling isolated facts, identify the underlying family system structure. Examine the patterns, boundaries, and communication flows between members. In each prompt, look for the systemic map. Ask yourself, how do these components interact? This clinical lens is what truly distinguishes mastery from rote recall. In Minnesota, the path to becoming a licensed marriage and family therapist involves several key milestones. First, ensure you have successfully completed all your required supervised clinical hours. Next, submit your formal application to the Minnesota Board of Marriage and Family Therapy. They will review your credentials to ensure all state requirements are met. Once the board approves your application, you will be issued an authorization code. This code is your key to the AMFTRB examination process. Finally, use this authorization to schedule your test date. Keep an eye on your email for the testing window instructions. In Minnesota, the Board of Behavioral Health and Therapy limits candidates to a total of 5 attempts at the AMFTRB exam. If you do not pass within these 5 attempts, you are not necessarily disqualified. However, you must formally request a variance from the Minnesota State Board to continue your licensure journey. It is vital to consult the official Minnesota Board website as soon as possible if you approach these limits to understand the specific documentation required for your variance request. The AMFTRB official practice exam is the gold standard for your preparation. It is the most reliable tool available because it is designed by the same organization that writes the actual test. By utilizing these resources, you encounter questions that accurately mirror the specific style, format, and difficulty level of the board exam. This provides you with an authentic test day experience before you ever step foot into the testing center. Prioritizing these official materials ensures your study time is focused on content that truly matters, giving you the best opportunity to succeed. Official resources are the foundation, but many candidates find success by bridging gaps with external programs. Popular tools like the Therapist Development Center, or TDC, and Dr. Lucas Vellini's guides are designed to enhance your clinical reasoning skills beyond rote memorization. These programs help you bridge specific knowledge gaps, sharpen your clinical reasoning, and provide a fresh perspective that complements official AMFTRB materials. Utilizing these tools allows for a more comprehensive review of the clinical landscape. Flashcards are one of the most effective tools for mastering complex family therapy models. They force you to engage in active recall, which strengthens your memory retention. For example, create cards that pair a major theory with its primary theorist and key techniques. Here we see structural family therapy, associated with Salvador Minuchin. Focus on the who behind the theories. Bowenian theory is best remembered by genograms and the concept of differentiation of self. Keep your deck focused on clinical applications rather than just definitions. Regular, consistent review of these flashcards will help you internalize these models for the AMFTRB exam. Your existing clinical experience is a massive advantage. Proficiency in the DSM-5 TR, evidence-based practices like TFCBT, and familiarity with ARM-HS documentation provide a solid foundation for the AMFTRB exam. The primary challenge is shifting your mindset. You are used to documenting for billing and compliance, but the exam requires you to prioritize the immediate, systemic intervention needed in the room. Focus your study on selecting the best clinical intervention based on the vignette. Use your deep background to quickly spot the systemic patterns, but ensure your final answer prioritizes safety and established therapeutic theory. In AMFTRB vignettes, you will often find multiple choices that seem clinically sound. The test requires you to identify the priority, not just the good option. The AMFTRB prioritizes safety and legal mandates above all else. Always address potential harm before attempting systemic restructuring or support. When a vignette mentions suicidal ideation, abuse, or legal threats, your priority is safety. Only after safety is established do you move to systemic or process-oriented interventions. A structured 12-week study calendar is essential for exam preparation. It prevents burnout while ensuring comprehensive review of all 6 AMFTR domains. By dedicating 2 weeks per domain, you can rotate through all 6 areas twice. This spaced repetition reinforces retention and helps identify your knowledge gaps. Balance your study time with your current internship by setting specific daily blocks. Remember, consistent quality study time is always more effective than occasional long sessions. A frequent error in the AMFTRB exam is searching for hidden meanings or complex backstories that the exam prompt does not actually contain. When the prompt lists specific symptoms, rely on established diagnostic criteria. The data provided is always sufficient to reach the correct clinical conclusion. The strategy is simple. Do not invent complications. Focus strictly on the presented evidence and apply your diagnostic logic. Cultural competence is essential for systemic therapy. The AMFTRB exam evaluates your ability to provide non-biased, culturally informed care to diverse populations. You must shift from individual viewpoints to a systemic and inclusive understanding. When encountering clinical vignettes, apply the systemic lens. Prioritize answers that demonstrate sensitivity to power dynamics, social location, and the broader systemic context of the family. In your test-taking strategy, always reject biased or stereotyping assumptions. Choose interventions that actively respect cultural values and maintain professional neutrality while acknowledging the client's diverse background. The AMFTRB exam is a marathon lasting 4 hours. Proper pacing is critical to prevent fatigue and maintain cognitive focus throughout the session. Divide your time strategically. Do not spend too much time on a single question. Keep the momentum moving to ensure you reach the end of the assessment. If you encounter a challenging question, do not let it stall your progress. Use the digital Mark for Review feature to flag the item and move forward immediately. This strategy keeps your anxiety low and allows you to return to difficult questions with a fresh perspective once you have cleared the rest of the exam. Welcome to the final section of our course. You have now completed all 23 modules of your AMFTRB exam preparation. You have built a strong clinical foundation. By consistently focusing on clinical reasoning and systemic application, you are now well positioned to pass your licensure exam and advance your professional career in Minnesota. Believe in your training and stay focused during the test. We wish you the best of luck on your path to becoming a licensed professional.